Good afternoon. I would like to welcome you all to part 2 of the mental health conversation with our Leaders in Lunch program. My name is Katherine Perry. I'm the Executive Director of Leadership Winston-Salem. I'm delighted to have you all here. At this time, I'd like to introduce our panel of community experts in the field of mental health and our moderator, and allow them to tell a little bit about themselves, and then we'll go straight into our panel discussion. So joining us today is Denise Price, Matthew Motsinger, Kristin Ryan, and moderator Gary Gunderson. I'm going to invite Denise to introduce herself and tell us a little bit about herself, and then we'll go from there. Denise?
Good afternoon, everyone. My name is Denise Price, and I'm the Behavioral Health Services Director for Forsyth County. This is a new position for Forsyth County, started about 6 months ago. Prior to that, spent 5 years at Public Health as an Assistant Health Director, and all before that, it was Behavioral Health Services. So very excited to be back into this area of specialty.
Thank you, Denise. Kristin?
Hello, I'm Kristin Ryan. I'm the director of the new program called the Bear Team, and that's housed within the Winston-Salem Fire Department. This is a new position here within Winston, but I've been working in the mental health field for the past 20 years in various roles, directing teams and response teams, and working both with mental health and substance use and individuals.
Thank you, Kristin. Brent?
I'm Brent Motsinger. I am a battalion chief with Forsyth County Emergency Services. I oversee our community paramedic or mobile integrated healthcare division. That's a specialized team of paramedics that go out and respond to people in behavioral health crisis and substance use emergencies. We also kind of work with the recidivistic 911 callers to try to put resources in place to help them out as much as possible. Other than that, just happy to be here. Thanks for having me.
Thanks, Brent. And Gary?
Hey, Katherine. I'm honored to be among these experts and really exemplary public servants. I'm Gary Gunderson. I'm Vice President at Faith Health at Atrium Wake Forest Baptist, and my particular division includes CareNet, which is community-based counseling all across the state. We have 4 chaplains embedded in the first responder networks, and so we care for many of the people that these experts have working for us. And early in my career, I worked with Mrs. Carter at the Carter Presidential Center in her program of mental health. And so this is a field near and dear to my heart, and I'm just honored to be here.
Thank you so much, Gary. And with that, I will allow you to take the mic and start our panel discussion today.
So you can see that all 3 of these content experts are on the public service part of this. And when I saw that, first of all, I thought, perfect. These are the people we're counting on to protect us and be there for the family members who I'm sure everyone on this webinar is here because we care for someone or care for ourselves who's been on the receiving end of this kind of care. It's why we care. And there's not a single family in the United States that doesn't have a family member or a close friend who does not experience mental health crises. But I don't want us to think this is just like the public servant's responsibility to do what we are not doing. And so they're not there. Instead of us, they extend the community capacity. They're there with us. And the real question is, as we listen to this, keep in mind, do churches have any capacity that might be relevant? Yes. Do community associations have any relevant capacity? Yes. Do our healthcare networks, and not just the big hospitals, but the hundreds of primary care practices, are they relevant? Of course they are. How about small business, especially those within conversation range of humans in distress? Often they know it first. Daycare operators, barbershops, hardware stores. Yes, yes, yes. How about big business? Yes, yes, yes. So this conversation, Leadership Winston-Salem, is about mobilizing the assets of the entire community so that the right thing happens most of the time. And when the right thing doesn't happen, we have public services that are there to oftentimes pick up the pieces what the rest of the community didn't do. So I want to go directly into what is really the second half of a conversation. The first half already happened. It happened in person, some weeks ago, and there was such energy about the issue of community mental health that Katherine and the team said, we need another conversation. This is that second half of the conversation. And the very last thing that happened in the first part of the conversation was, what about BEAR? What's that about? And it's a new capacity that's coming online. And so in the spirit of a continuing conversation, I want to just pick up right where we left off and go directly to Kristin and tell us about the BEAR program. And I'm really curious about how it came to be. I'm sure this isn't the only place in the United States, but we're really interested. What's here now?
Well, I want to start by saying
my
I am. Well, I'm honored to be here. And I was at the first one, and I was very proud that Winston-Salem has instituted another program that can really tie things together for our community and the resources that we currently have. So the BEAR team stands for the Behavioral Evaluation and Response Team. It is an alternative response to 911 calls. So we are going to be first responders for any individuals in need of substance use or mental health intervention services. It'll be a team of 6, 7 including myself, of crisis counselors, well trained in both mental health and substance use intervention tactics. The team is going to have the ability to work right along with all community providers and to assist individuals with linking to the services at the right level of care, and be able to go right into the homes, provide on-spot services, and really identify and assess what's needed at the time to help the individuals through the crisis event and as well through the follow-up piece of that. The BEAR team it is a fire department program. It has been a thought for a little while between the city as far as some solutions in response to mental health and substance use calls. It's funded by the American Rescue Act and currently, and additional funding, will continue as far as requests and in the outcomes and how the team performs and what kind of resource we will be to the community will kind of determine the future of what type of funding we'll receive to continue. We will be working right along with the 911 dispatchers. They're going to receive additional training that they are well versed in identifying behavioral health calls. They're going to also receive additional training to ensure that the calls that the BEAR team do go out to are appropriate, nonviolent, and have additional support from us as the team, the fire department and law enforcement to really work together to ensure that the right response is being sent to any individual that does utilize the 911 system. It's going to change the way that our current responses are right now. When somebody calls 911, law enforcement, fire department, EMS, they all out respond and then determine what level of care is needed at that time. The difference will be that it's going to be determined right off the bat, and we're going to be able to still continue to work together, but they'll receive a mental health provider first. So that is a little different in the response. There are some other teams around that in North Carolina and across the United States that have developed co-response teams. The BEAR team is unique in the way that we are the first responders, and it's not considered a co-response with law enforcement. We are the alternative. So there are some similar programs, but that's how the BEAR team is unique in that way. So I appreciate the opportunity to present the team to Winston-Salem and look forward to any questions you all may have.
So Kristin, I think it's really interesting this is lodged at the fire department. I know there are numerous surveys are always done about who does the public trust? And the fire department is always at the tippy top of the list, above clergy, above above doctors, above police, above anybody. The fire department is always the most highly trusted agent in the entire community. And I asked somebody sometime, well, why is that? They said they always answer the phone. And
And the fire department is very, having a mental health program within the fire department may seem strange to others, but when you're looking at the actual service delivery, the fire department is out in the community doing many, many public service events and community events on a regular basis. It is a normal part of their day that I think most may not recognize. So it will flow very nicely.
in one sense, this is building on a level of trust and a capacity and a set of expectations that's already there. Because I'm sure your phone constantly rings with mental health, anxiety related kinds of calls. And so this you're really just building on a platform that's already there. This wasn't just, well, we'll stick it over in the fire department.
And it is just going to be an additional resource for the community. The BEAR team cannot really adequately help any individuals without all of the programs in Winston-Salem and the utilization of every service that the city offers. That's why the programs within MIH, as we have Brent here and Denise, and the programs that they're going to be discussing, this is all will be a community effort in helping all individuals that are in need of services.
I'm responsible for sounding an acronym alert. What was MIH?
The Mobile Integrated Healthcare Team with Brent.
That's what we were told to beware of acronyms, and
I apologize.
have a bunch. Do I understand it correctly that that the city and county are moving towards sort of a common 911 facility where these calls come into a place that, I mean, you're not having to shout across the street. There's actually sort of a much more common linked process. Is that true? Yeah.
I can't speak entirely to any type of time frames of things in that, but there is discussion about, collaborating and utilizing those systems jointly. At this time, they work very closely together, but that's not something I can speak to as far as
Just saying,
future plans.
if you go to my parking lot outside the emergency room of the hospital, you'll see, police, fire department, EMS, all of the uniform public service are really one big team. And so I think that's what's happening. Well, I know we're going to come back to Kirsten because the BEAR capacity is new and significant, and I believe is really going to be change making for our community. I want to flip over to Brent and talk about your work. Not every community has the community paramedic process. That's a novelty that emerged not too long before COVID. And I know during COVID, it's been radically needed in essential service, but on the front lines. And so I just want to open the space for you to describe this capacity a little bit.
Sure. And once again, thank you for having me. I'm super happy to be here. I always love bragging on this team, and that's what they are, is an amazing team. And all I do is just show up and present their work. That's my entire job. But this team actually started in 2016. The agency received some funding from a Cardinal, who was our MCO at the time, Innovations Grant. And it was really to deal with recidivistic 911 callers. So those people who call 911 a lot of times. And when we started looking at who those individuals were, we started just kind of realizing they had a lot of the same complaints and a lot of the same transport needs. And a lot of them had behavioral health and substance use issues. So we were like, well, how do we learn more about it? So we took a team of 3 then. We're up to 9 paramedics now, including myself, who actually go out and respond to these individuals who either call 911 multiple times or that are just requesting further assistance from the 911 call that they're currently on. It could be someone who is having a behavioral health crisis, having delusions or schizophrenia or just depression or anxiety or suicidal ideations. And we go out at either the request of law enforcement or our EMS fellows or the fire department as well. In some cases, a lot of times without, out in the county to really kind of meet these individuals where they are and help them really connect to the resources that they truly need. And I'm so excited to have Kristin here with the Bear team. I'm looking forward to working with them so much because it's just one of those things, like she said, we are all kind of one team, one dream, and none of this works until we all work together. And I found that was one of the biggest hurdles in dealing with mental health in this county is getting the right hand to talk to the left. And everybody always makes the statements that we're all living in silos. And my job is to kind of walk in and help tear down silos. And now Denise's job is to walk in and tear down silos. And I'm so lucky to have her. But our team actually has, we have been kind of the Swiss Army knife of EMS for a while. When COVID hit, we kind of changed that running of the recidivistic call volume and a lot of the behavioral health emergencies, and we had to kind of go into a COVID mode. So we were actually some of the first ones to do some offsite testing and vaccinations with public health. I was the second person in the county to get vaccinated, and I think Denise saw it. And I think she was just waiting to see how it affected me, to tell you the truth. But other than that, we actually were able to work with public health and set up a really cool shelter for homeless individuals that were COVID positive so that they had a safe place to quarantine. And one of the cool things that we were able to add to that was kind of a social work and case management aspect to it, to where while we had these individuals kind of in a place to where they could be, steady for a little while, we could say, hey, is there anything we could work on while you're here, getting you meds, getting you housing, getting you some benefits and stuff like that. And that worked great for us and those individuals as well. So since then, we've gone back into more of a normal day-to-day operations, just trying to monitor and help those individuals that we encounter that truly just don't fall into a normal emergency room type category. I mean, when you're in a behavioral health crisis, calling 911 and having the option to go to the ER is not the greatest option sometimes, because that place is structured and built for that emergency. And sometimes they don't see behavioral health as a true emergency because you don't have a missing limb or you don't have crushing chest pain that somebody needs to fix right now. But there's some scary statistics that I have pulled, and by not addressing those crises in an emergent manner, there's been some very bad outcomes within our community, and we're working with the emergency departments to address it. And we also now have the capacity to divert individuals away from the emergency department into local resources, which, like Kristin said, we just keep establishing that network and building and finding facilities and providers that we're able to divert these people to truly connect them with the resources they need in a timely manner, so that they're able to see a success. Because that initial interaction when you're having a behavioral health emergency, if it's not a positive one, if it's not somebody saying we're here to help you, there's something that can be done. If they're met with no, then there's the really high chance for bad outcomes, and that's what we want to avoid. But other than that, we've just been tirelessly working these days to try to help as many people as possible.
Brent, first responders are loath to talk about themselves, but in the conversation we had as a panel getting ready for this, I managed to probe you a little bit, kind of out in the open, about why do you care about this? Why are you? I mean, you could do like a billion things. What is it about this particular mode of public service that feels right for you?
I think for me personally, it was a desire to help people, but I honestly and truly, it was the fact that I saw that there was so much that could be done that just wasn't getting done. And before I entered into the EMS profession, I was a Navy corpsman. I worked with the Marine Corps as a medic for 7.5 years, did 2 deployments. And, as I came back here and, started working as a paramedic, I realized, some of the stuff that I had seen in the Navy was just like, this pales in comparison to some of the stuff that I'm seeing on the streets as a first responder. And, having to really kind of look at my own life and my coworkers' lives and how these, traumatic events and, all the death and horrible calls that we run affects each other, then it really kind of spurred me to take control of my own, mental health. And, I go to regular counseling, and it's like I told you guys the other day, the stuff from my military background is not at all what I talk to my counselor about. It's the stuff I've seen in the EMS world. So I really have tried to also help foster a huge program of peer support and work with the chaplaincy at Wake Forest to really develop a way for first responders to also reach out and connect into the mental health care world, to really prevent them from getting fatigued or PTSD, or to really kind of teach healthy, coping skills and things like that, so they can have a really healthy, long-lasting career. Because when I say we're hurting as in EMS, I mean, we're hurting. So the more people we can keep healthy and on the streets doing the job to provide that care to our community, that's the number one goal these days.
Thank you for both your former military service and your current frontline service. I appreciate it.
Thank you.
I'm sure everybody on the webinar is humbled. Give me some sense of volume. What, like, how many?
So I actually ran the numbers again this morning, just so I would have updated stuff for you. In 2021, the number of behavioral health and substance use related calls that EMS ran, these are the actual tickets. There may have been more actual calls, but the actual tickets that people were transported and a paramedic touched were 6,820. And that is out of our call volume of 44,000. So that's our second highest number of calls. Like, that's those complaints were our second highest call volume complaint. They were all related to behavioral health or substance use. In 2022, it declined. It went to 5,699. 2021 was more kind of in the heat of COVID, and a lot of stress, a lot of cumulative issues, a lot of substance use when people were home alone, and they honestly, they were kind of living in fear and in misery and not reaching out. And so whenever it did get to the point that they needed help, they were in crisis. So they interacted with 911 more. And believe it or not, this year in January, we're already at 462. So, and that's all together behavioral health and substance use. So, no, excuse me, 262. So, but.
What do the people look like? I mean,
they look like you and I. Everyone, behavioral health and substance use knows no boundaries. It does not stick to one specific race, creed, color, sexual orientation, nothing. And more specifically, I think the opioid task force that I work so closely with Denise and them, they could vouch for it more than anything. It really doesn't care what socioeconomic demographic you are either. I mean, you could, I've run calls. Well, let me tell you, the exact age from the youngest was 13 that I had a heroin overdose, and the oldest was 76. And it was, so really and truly to span that age range, it's just mind blowing to me.
Wow. We're going to come back a couple laps around the panel, and by the way, I really want to encourage people on the webinar to be asking questions. We'll integrate that, and I have promised Katherine that we would leave space for the interactive part of this. So we will. But I want to flip to Denise. The role of the public health department, not the hospital, the public health department, having behavioral health services. Not every public health department has that. We're probably in a relatively small number of counties nationally out of 3,000 that have a Denise, and we haven't had Denise for that long. So I really want to open it up. She comes with a deep background in mental health, but to some degree a beginner's eyes on our community in her current role. And so I think this is a perfect content expert to help us see who we are and what we should be doing. But Denise, let me just Let me just open it up to you a little bit.
Thanks, Gary. So Forsyth County has taken a unique approach, and I'm very proud of the approach that they've taken. It's based on our leadership and our elected officials' awareness of the great need in our community. So Forsyth County operates under a health and human services model, and under that umbrella is public health, DSS, our Family Justice Center, and behavioral health services. So under behavioral health services, we have several programs that I'd like to share with you. We have a Stepping Up program that has 2 programs in it, a mental health court that is a court supervised treatment program for individuals that are identified as having a mental illness with pending charges and have agreed to participate in the program. It's a pre-plea court that links eligible defendants to treatment and supports that they need to help them to manage their mental health. They also have a super program. Super is the Stepping Up process to end recidivism. It primarily helps individuals in transitioning planning from the detention center to the community, provides peer support services and case management, and can follow individuals for up to a year or 2 as they transition back into the community. Very successful in avoiding recidivism. We also have a pharmacy. It's a limited formulary pharmacy, primarily dispensing behavioral health medications. About 70% of what they dispense is behavioral health medications. They also work with EMS to make sure that they're stocked, and our wellness program for employees and our public health department for their clinics. The pharmacy operates a robust patient assistance program valued at about $3 million a year, where individuals can be linked to manufacturers to get medications at no cost. So the pharmacy is a wonderful option if you or if someone you know has behavioral health medications that need to be filled and cost is a barrier or access is a barrier. Feel free to give them a call. We'd be happy to try to figure out a way to help you. We also have, as Brent mentioned, a substance use health educator. That individual supports, promotes, and engages in efforts to address substance use in our community, and also leads our Forsyth Regional Opioid and Substance Use Team, otherwise known as FROST. They really work to help us to be aware of emerging best practices and look for opportunities to better engage and meet the needs of the community. For example, our health educator was able to work with the state to secure a naloxone vending machine, naloxone being a medication that's used to reverse opioid overdoses. That machine is in our Forsyth County Detention Center lobby. It's available to the community. Folks can go in, get naloxone at no cost to them. So really doing some creative work to try to break down stigma, make sure that resources are available in the community. We have a certified peer support specialist who is primarily located at the Central Library. He mostly works with individuals experiencing homelessness to connect them to resources, but also with anybody in the community that needs assistance, and can meet folks at any of our 10 library branches. I think you've become familiar with mobile integrated health, although it's not a part of behavioral health services. Brent and I work hand in hand on most days, sometimes multiple times a day, to address needs in our community. So we have a lot happening with Forsyth County. And of course, I'd be remiss if I didn't say we don't do services per se. We have some supports, but we work very closely with all of our community partners. And that's folks that are working on the preventative side, folks that are providing treatment, small organizations, large organizations. I think Brent and Kristin both said it so well. This is an all hands on deck approach. Not one of us can do it individually. It takes all of us collectively.
So Denise, I'm a public health guy from way back. The public health at its best is never noticed. I mean, if perfect public health is that it's so good at preventing things and anticipating and preventing that you never even know it's there. But I think people would probably are a little bit surprised at the range of initiatives and programs that you're describing already exist in Forsyth County, lodged in the public health department. I mean, that's give me some sense of numbers and data and I mean,
So actually, Gary, we are organized under Health and Human Services, not public health per se, although we are a public health focused
Thank you.
section. It's just that we're under the same umbrella of Health and Human Services. Each of our programs has different numbers of folks that they serve, right? So if you're in thinking about our peer support specialist, we have a homeless caucus. So our homeless caucus, he helps to lead, and generally we have 25 people who come to those meetings. So that's wonderful. That's a way for individuals that are unhoused to really be engaged in what happens in our community for them and with them. We also, our Stepping Up program has capacity to serve additional people. So if you have referrals, let us know. But at any one time is serving between 20 and 40 individuals. So that's a lot of folks. That's a lot of folks that have severe and persistent mental illness, that have supports to help them to remain stable and to stay out of the emergency rooms and to live their best lives.
thank you. We're almost exactly halfway through the hour. I'm a little shocked when I noticed that, but I want to open. There've been a few questions in the Q&A section. I want to make sure we answer that before we cycle back around and do another, kind of go deeper into some of the intersections I've heard here. So Forrest Truitt asked about mental health and suicide statistics, and how do we get this data? If people want to find deeper data, how would they do that? But who here knows that?
So I think we can drop some information into chat for you. There are definitely some links to some resources nationally, depending on what survey you're looking at. We're seeing 1 in 4 or 1 in 5 individuals have meet criteria for mental health diagnoses. Substance use is also a staggering number. We can send you information about suicide statistics. Suicide is actually the second leading cause of death for individuals 10 to 14 years old. So I would encourage you, I see Jared dropping that information into chat now. Take time after this session to read through those materials. It will help you to understand the prevalence.
Terry Sargent asked a closely linked question about the range of services. Where's the list of them? And do our schools understand what's here? And then she asked very specifically about mental health services for younger kids, the 4 to 12 kids. You never thought we even have a category of concern for younger kids, but I know it's a really big issue.
Great question. Christian, Brent, do you want to take this one or you want me to jump in?
Well, I can tell you for pediatrics specifically, there are it's a very, very, very few and far between services out there these days. And one thing that we're coming to find, not so much between that specific age range in pediatrics, but more as they get into the teen and a little later years, they could possibly become dual diagnosed, which that means they could have a behavioral health diagnosis like maybe anxiety or depression, and then they could be seen for something called a substance use disorder. That is where they may have used like an illicit drugs like marijuana or something like that on a chronic basis. And so, and if you become what's called dual diagnosed, and then the availability of resources for you as a pediatric is almost non-existent. Like they're almost, it's almost impossible to find the inpatient rooms for those people. I can also tell you that just resources in general, we're starting to get more and more out there. Denise is the one that really is more familiar with the current lists. And we actually put together what's called a crisis brochure that we work with Denise on. Yeah, see, she's got it right there. And so I update it every year, but she's the lady that makes sure that I do that and make sure that it's all correct. So, but she puts that out and make sure that it's all up to date. So, and if anybody really and truly wants to start looking for resources for that, Denise would be your primary contact or your pediatrician. And if they don't know, they should hopefully know to call Denise.
Okay, there's some great questions in here. And meanwhile, Kristin's hard at work answering some of these questions. Pretty cool. So I hope everybody's paying attention to the Q&A section because we're getting these as we go. Both Rachel Zimmer and Pastor Sostada sort of made a similar observation about the array of leaders that are in this field that are really doing pretty amazing and creative work. We're not just standing still, we're making new stuff as we go. But this stuff really rests on the community needing it, wanting it, being available, being a conscious, articulate advocate on behalf of this service. And it's not just, I'm sort of, I don't want to put words in your mouth, but it's not just a matter of money. It's a matter of real knowledgeable support so that you're free to go to the limits of what's possible. Or do you feel like you've got that support? Do you need more? I mean, there are a lot of leaders on this call who could probably lend more support if they knew what you needed.
I can speak for myself on this one, but I feel like historically EMS, fire, and police have always kind of had a stigma as far as mental health and the way that it was addressed within that realm of things. That is, I wouldn't even say slowly but surely changing. It has had a drastic change in the 5 years that I have been working at this, and to see the acceptance and to understand more than anything the importance of reducing the stigma around mental health issues and substance use issues, and seeing that, you know, everybody from law enforcement on down has really kind of jumped on board with really kind of helping to get these people to the true care that they need. And now, like, when law enforcement calls us out, they've been through crisis intervention training during their kind of initial orientation into working with WSPD or the sheriff's department. I send my paramedics through crisis intervention training. And one of the big things that we do is we support them, because all I care about is those officers get on scene and they're smart enough to recognize what they don't know. And that they say, okay, well, this is something that probably has a mental health component to it. Let's call somebody who has a little bit more experience. So they'll call one of us or a trained mental health clinician, or get somebody out there that can really de-escalate the situation. And that's been one of the greatest tools that we've had, is that ability to step in and say, all right, you guys go, you go take your, the law enforcement side of this out, and we can deal with this as a medical issue, because that's truly what it is. It needs to be seen through the medical side of things, and we can really connect them. And I think the biggest part of everything is just reducing that stigma. And that's something that we address on a daily basis.
Mrs. Carter, founded her entire mental health career and said stigma is number one, number two, number three, number four, that the biggest barrier to people getting what they need is the stigma about it. And that the first word that many of us who are lay people in the field, she was speaking specifically of clergy, should be apology to those who have been suffering with mental health burdens in their life and are somehow made to feel like there's something wrong, that they should apologize for. We should apologize for the stigma. They didn't create the stigma. We created the stigma. So I really sort of underline that for everybody today. So let me flip in a little bit of different direction. I sort of opened my comments of saying, with as much as I'm grateful for and encouraging of these public services to exist in our community, I don't want us to feel like that's enough. And so I kind of want to almost flip the panel and ask, what would you be wanting? We'll just start with clergy. Attack my folks. What would you want clergy to be doing as upholding their part of the challenge while you're doing your part?
I can start by commenting on that. Within the clergy, I think the biggest role that's needed in that you do very, several different services, but it's the support. It's the acceptance of the individual. It's the, oh no, you don't, you have to go to this program or this. It's any door is an open door. And having that be the attitude as a community, I mean, we all need to do better at that. There is no wrong door. Everybody has the ability to assist, support, and guide any individual in need. The individuals that are in need, they come all ages, rate, and you don't know what it's going to be, but if they come to your door, don't send them to another door. Your door is the right door because they walked in it and they were willing to share their story or to ask for it. It's the no wrong door attitude that I really think is probably the most beneficial for any community that's trying to support individuals with mental health or substance use issues, because it's hard for any person to say they need help. So to ensure that when they actually take that step and call for help or say or indicate a need for it, that you're the right door and you help walk them through until they're getting that support.
I suspect Pastor Danielle agrees with that.
Well said. If I could add to that, and I think this was part of your point, and it's not just for our faith community, but for every aspect of our community, it's our fabric that we are all connectors to care. And as connectors, we have to be aware of what's available in the community and help to direct folks. So it was great to see some of the questions about where do we find out more. For instance, do folks on the call know that Forsyth County has a behavioral health urgent care? Think of it as an urgent care where you go to get medical services if you break an arm but don't need an emergency room, but it is a crisis and it needs immediate care. 24/7, 365. Daymark Recovery Services operates the behavioral health urgent care at 650 North Highland Avenue. You don't need an appointment. You just show up. So it's getting people connected to the services that they need at the time that they need them in the right amount in the right place.
Our Faith Health Division has long had sort of our principles of engagement, right door, right time, ready to be treated, but also not alone. And that when you're in a medical emergency or mental health crisis, the last thing you need to do is be alone. But you need someone who's actually with you, who knows something. So just having someone who doesn't know something doesn't help too much. So, but that notion of a fully accompanied community is cool. What about small business? We talked a little bit about clergy. They sort of know they're part of this team mostly. What about small businesses? I'm just thinking daycare and barbershops and beauty parlors. They often have, ears for these challenges before they get to a 911.
I would
And they're
say,
trusted resources, right?
yeah,
People talk to their barber and their beautician about things they'll talk to no one else about.
very true, very true. And I wanted to say one quick thing about the clergy as well. We actually work a lot with many different resources in the county. Since we are the county, we really try to reach out to everyone. And we've engaged people with like Triad Baptist to build ramps for people or give rides to whoever needs to go to mental health visits or substance use treatment or go to AA or NA, or which is Alcoholics Anonymous or Narcotics Anonymous meetings. I see this issue, this kind of epidemic of opioid abuse and mental health care that's really kind of it's in our community. It's here. We're addressing it on a daily basis. It's a great opportunity for the clergy and the church community and small business. Anybody who wants to be involved, just get involved. Every little bit you can do helps. Giving a ride to a mom that needs a ride to work, or that needs talking to someone who just needs to talk, or watching somebody's kids while they go to a doctor's appointment. Something as small as that can be life-changing. I mean, I've been on the scene where I gave Narcan to a mom that overdosed in her car on her lunch break at a business, and she was just like, I have to go back to work. And I was like, well, you almost died 10 minutes ago. She's like, yeah, but I have to go back to work and I have to make money. I have to be there for my kids tonight. I'm trying to beat this. I just can't do it. And that's where she was. And just understanding that you have to love someone for where they are. You have to be understanding of where they are. They may not be where you want them to be right now, but that's okay. That's where they are. And that's where you have to meet them, and you have to be understanding of their individualized circumstances, and just try to have a positive, helpful attitude towards them and their issues. And one more thing is, there are lots of different treatment options for mental health care, for substance use. Some may not be so accepted around the country, and some may have some different treatment modalities or treatment options, like, and be seen as, why give one drug to replace another drug, or things like that. And you'll hear that when you hear people talk about, ways to treat addiction and things like that. But as far as behavioral health care, understand that a lot of the medications that these individuals get placed on, it's not fun to be on those medicines. It literally, it changes their lives. It changes their body's way of functioning. It makes them feel totally different. So it's not something that they choose to I just choose to have this behavioral health crisis right now. It's just like, no, I would rather feel like this than the other option. So, and just having that understanding attitude towards it, and helpful mentality, it goes such a long way. And just being there for just a random stranger when they need you to be.
Gary, you're on mute.
I'll do so much better with the mute button next pandemic. I was frankly just taking in what Brent said, and the sheer human wisdom and intelligence that y'all all lend to this is part of. I'm just imagining this conscious, compassionate community that's also connected. That's really where any one of us would want to live, and you're helping create the kind of community that it's safe to live in, and one that we can raise families in and actually be present in. So I'm just very grateful. As a taxpayer, I'm grateful for y'all. I'm curious about what we haven't talked about. What's not here? Where would your imagination lead us in this group? This is Leadership Winston-Salem. These are the folks who can actually change the narrative in the city about who we want to be. What would you want the leaders of Winston-Salem to be talking about in this domain?
For me, it's just a continued conversation and partnership. We have, and we need to continue with members of our community on our opioid settlement stakeholder committee. We need everyone in this community helping us to break down the stigma, the 1, 2, 3, 4, 5, and 6 on the list, right, Gary? We've got a lot of ideas. We've got a lot of things in progress. So our community staying engaged and being aware of what is available so that they can be those connectors to care.
Kristin, we normally don't ask public servants to tell us what they want us to do, but that's exactly what I'm asking.
I'm going to kind of speak to what she's saying, and really that connectivity, and just helping keep those conversations with all providers. And, it is a community event. This is not something that the Bear team or one team is going to resolve and assist all individuals. It has to be a community event. So the leadership has that opportunity to keep, and I've seen them do it. I'm very proud of the Winston-Salem for their initiatives in making sure that people are talking and connecting. And just in my short time here in Winston-Salem, I have been, anytime I talk to one person, they introduce me to another, and hey, you need to meet this person. It has been an amazing experience. I think there is a lot of work that is being done currently to help everybody work together, and just that really continued effort is what's going to be needed, and making sure that it's not just my job or your job. It's everybody's job and making sure that, that we're all working together and it's a community effort to help out all citizens in the city.
Denise mentioned Highland Center. Not everybody in town knows that's the most dramatic example of structural collaboration. That's a joint venture of pretty much everybody who matters in the city, including the two hospitals, which sometimes we do not behave as adults towards each other. But on that piece of land, we do behave as adults and collaborate and do the right thing for the city, for each other. So I think there's some actual structures that are collaborative in nature in this community that actually we should be proud of. We could probably behave better more frequently, but at least that one time we're actually getting it right. I'm really proud of that. I'm about to turn this back to Katherine because she's the leader of this band and leads Leadership Winston-Salem, and I'm certain there's some implications that have come out of this that are significant for. I mean, the Leadership Winston-Salem is in of itself a crucial asset for normalizing, for making normal conversations about things that often are not the common conversation. So I, first of all, appreciate Katherine and everybody on the call from Leadership Winston-Salem for helping mental health become a normal conversation, something we can do something about, not just quietly feel bad about. And so I just really want to honor the organization and Katherine for making this conversation happen. And it's not the last thing we need to happen, but I really want to honor that. I really stressed, yes, public servants who are worthy and are honorable and noble in their work. It's really quite remarkable. And it's everybody in the community in very nitty-gritty practical ways. If you're running a small business or a beauty parlor, you ought to have the bare number in the card, and the thing that Denise held up, you ought to know that. You ought to have the EMS call so Brent can get the call quick, not slow. I mean, that's very minimal standard of any organization in our community that touches human beings should have that stuff. So that the most practical thing that's necessary at the right time when it's necessary, you already have it. So I'm sure Katherine will do the follow-up, make sure that people have all the phone numbers and cards and stuff. These other opportunities that Denise is talking about these are big time civic opportunities to get stuff right, or to just sort of let it drift. Well, let's get it right. Katherine, I'm going to turn it over to you now.
Thank you, Gary. First of all, I want to make sure, Gary, did you get to all the questions that were listed in the Q&A?
I saw 6, and I think there might have been, one popped in that I did not see. The very last one was from Rosia Salvador. Phenomenal group of young Latino kids, my community. Oh my goodness, this is what we need so much. Thank you. 13 to 18-year-olds that would benefit from hearing about the statistics. And so that's an invitation to engage and meet. And if he's aware of, a small group, I'll bet there's a really big group. So I'm sure all 3 of these people would come and talk in a heartbeat to be there. And of course, we've got someone that Pastor Danielle probably knows that group, and Enrique Catana. There are folks who do that. We will be led by the youth.
So we will be sending out this recording to everybody that has registered for the Leaders in Lunch today. And in that recording, we'll include contact information for Brent, Denise, and Kristin. So my thanks to each of you. My thanks especially to you, Gary, for moderating our conversation and for explaining what Leadership Winston-Salem is. We do have a few folks on our call today that are not Leadership Winston-Salem family members yet. And so explaining what we are in this community, being a community convener that works on educating, connecting, and energizing leaders to serve and improve the community, especially over issues that are of importance to Winston-Salem and Forsyth County, as well as our nation and our community. That is our focus, and that's why conversations around mental health are important to us, and why we followed up with a part 2 after our first part, which was in January and was an in-person conversation around mental health. So my thanks to you, my thanks to each of the panelists for their time today, not only for what they do in our community, but for taking time out of what they do in our community on a daily basis to answer questions and share their thoughts around what it is that we can do as a community to better serve one another. I'd also like to give a special thanks to Jared Stewart, who is our Administrative and Technology Director, who made this call happen and put all that great information in the chat. He was Johnny on the spot with explaining acronyms and providing links for our participants to see and take advantage of in live time. So thank you to Jared. My thanks to our Leadership Winston-Salem family for their care and concern about mental health and care and concern about one another. We do have a few additional events that I would like to bring to folks' attention before they jump off this Zoom and back to their normal life. On Tuesday, February the 21st at 6 p.m. at Forsyth Technical Community College's Strickland Center Auditorium, Leadership Winston-Salem and the City of Winston-Salem's Human Relations staff and commission members will be co-sponsoring a trust talk. In this talk, Winston-Salem Police Chief William Penn, Forsyth County Sheriff Bobby Kimbrough will discuss ways that law enforcement and the community can work together to prevent an incident such as the fatal beating of Tyree Nichols. Dr. William T. Lewis will co-moderate the discussion with members of the Human Relations Commission, and there will be a Q&A afterwards. We do ask that people interested in attending use the link that Jared is getting ready to put in the chat now to register so that we can plan accordingly. One last note, Leadership Winston-Salem is recruiting right now for our next best class ever, which would be the class of 2024. My apologies, Denise, who is a member of the class of 2023. They're going to try real hard to be better than you guys. So we're recruiting for those folks right now. We would love to have any of our Leadership Winston-Salem family members to nominate. Jared's going to put a link in the chat to that nomination form. And if you are interested in learning more about Leadership Winston-Salem, Kristin and Brent, you can go to our website and nominate yourselves, and we can be in touch with you and let you know about all the upcoming information sessions. So again, my thanks to each of you today for caring about our community enough to join us. And I hope that you each have a wonderful day and weekend. Thank you.
Thanks, guys.
Thank you.